Fertilization Laboratory Egyptian perspective. Firstly, I would like to thank our scientific discussion panel doctors who accepted to be with us today. Professor Dr. Hassam Zaki, Professor Dr. Medhat Amer, Professor Dr. Ashraf Abu Ali. Especially thanks for Dr. Abdelhamid Wafi and Dr. Raja Mansour for their great support. The story started 2 months ago when the WHO declared COVID-19 as a pandemic. On response to this situation, the Egyptian Society for Embryology and ERT established a task force composed national IVF lab directors to establish recommendations on how to deal with this crisis. In order to reduce this risk of transmission of COVID-19, many societies like ASRM and ESHRE recommend suspension of all non-urgent procedures. However, these recommendations may not be suitable for all community, especially no one can predict the dead time for these pandemics. The mission of the task force was to prepare a list of pragmatic recommendations coping with this international crisis. As Dr. Fauzi mentioned before, we should prepare ourselves for this new normal opening. Our webinar today will be in 3 parts. Start with 3 short presentations, approximately 10 minutes for each one, followed by scientific discussion by our professors, and then answering all the participant questions. اعتقد ان احنا كلنا مصريين، فاعتقد feel free لو حد اوريدي عايز يتكلم in Arabic مفيش مشكله خالص. فرانكو اهراب مفيش مشكله خالص. اعتقد كل الناس الموجوده مصريين. Start with Dr. Ahmed Nasr. First presentation. Dr. Ahmed Nasr, he is a master degree from Leeds University. He is a senior embryologist at Medina Center, Alexandria. تفضل دكتور أحمد.
اولا I'm honored to take a part in this event يعني، وان انا يبقى عندي الفرصه ان انا اشارك معاكم الشغل اللي اشتغلناه مع special و remarkable group بصراحه من Egyptian senior embryologists وناس من اعظم الناس اللي انا بتعلم منهم كتير جدا. زي ما قال دكتور زياد, today we will be presenting and discussing the document produced by the ESEART task force to pragmatically cope with the current situation of this pandemic. أنا أكيد أنتوا كلكم عارفين الباك جراوند وفاميليار مع الكاركترستكس بتاعت COVID-19, بس let me go through some points briefly to remind ourselves about what we are dealing with and why this virus is different. Pneumonia of unknown cause was detected in Wuhan, China, and first reported to the WHO country office in China on December 31. The outbreak was declared a public health emergency of international concern on 30 January. On 11th of February, the WHO named the virus COVID-19. And on the 11th of March, the WHO characterized the COVID-19 as a pandemic. طبعا ال COVID-19 من أهم البوينتس اللي ممكن نحطها في بالنا إنه about 80% of the infected people are asymptomatic and shedding virus all around them, infecting their team members, families, and everywhere people around them, and with infection rates of about from 4.7 to 6.6. The COVID-19 is very and highly contagious and more infectious with a very higher mortality rates than the normal influenza strains. The international recommendations from various societies and from them the ASRM and ESHRE have recommended that all assisted reproduction treatments should be stopped, no starting for any new cycles, no frozen embryo transfers, freeze all policies for the running cycles should be applied, and the fertility treatment should be limited to fertility preservation for oncology patients. And like everywhere else in Egypt, the situation was not clear, accompanied with the absence of a national guidance on how to deal with such situation, especially in the IVF sector. And unfortunately, the international recommendations sounded far from being easy to be applied in our country. As a response to this situation, and from a sense of responsibility towards the ART community, the ESEART found a task force to analyze and discuss the situation in the Egyptian IVF labs in order to produce a document or a consensus on how to deal with such situation. A random survey was done to observe the effect of the pandemic upon the IVF centers in Egypt and how clinics responded. The survey was made in the period of the end of March and the beginning of April. The results زي ما احنا كلنا عارفين طبعا من الشغل اللي قل في الأماكن كلها. بس بالنسبه لنا we're more motivating for the task force to speed up البروسيس ان احنا نطلع الدوكيمنت ده in order to aid او نساعد ال ART community and help preserving the safety of the healthcare providers. زي ما حضرتك شايفين ال IVF cycles, one of the results from the survey that the IVF cycles have decreased by a rate of 52% average in the all IVF centers all over Egypt. This slide الكاتيجوريز اللي اتأثرت في الفترة دي بتاعت البانديميك. The first category 13% the centers that reached complete shutdown or were on their way to this state. تاني حاجة 49% دي كانت centers that applied the policy of being very selective to their cases and counseling the patients to postpone initiating IVF treatments until further notice or that when the situation is clear and well understood. ثالث category 20% دي كانت centers that clearly refused starting any new IVF treatments and limited their work for fertility preservation أو للأونكولوجي patients وكانت بتطبق الفريز أول بوليسي للسايكل كانت already شغالة وما كانش بيعمل any frozen embryo transfer cycles. آخر category 18% دي centers that kept the workflow to normal with no modifications أو أي يعني decrease in the workload. كان من ضمن الأسئلة اللي اتسألت والحاجات اللي طلعنا بيها من السيرفي إنه does the IVF clinic or center have a clear action plan ready to be applied in case they received the news that one of the members of the team members is infected? The result was that 36% only of the clinics or centers had a ready clear action plan to be applied in this situation, while 64% did not have a plan ready to be applied. Also كان من ضمن الحاجات ان احنا سألنا هل في active regular testing for the team members. طبعا ده كان وقت ما اتعمل السيرفي اللي هو at the end of March. ممكن تكون الريزلتس دي او اكيد اتغيرت the result was ان 55% كانوا بيعملوا regular testing for team members، والتستنج دي كانت ranging من كذا حاجه، منها checking السيمبتومز، taking body temperature، في ناس كانت بتعمل CBC. الموضوع ما كانش محدد في حاجات معينه، بس كانت الناس بتجتهد وتحاول على قد ما تقدر ان هي تعمل regular testing للتيم members بتوعها. The situation in Egypt and the numbers concerning the daily new cases with mortality rate gave us the indication that we do not have a clear view on when this will be over and whether we reached the peak of this pandemic as a country or not. So it is agreed that this will be the new normal for an unpredicted time frame. In Egypt and presumably in similar countries, the economic burden which centers are facing ممكن يكون extremely bigger when compared to other centers in Europe or US. With this includes برضو responsibilities towards their teams and the working personnel which are providing for their families. غير كده ان في new findings every day، كل يوم في حاجه جديده بنكتشفها عن الفيروس، عن طريقه مكافحته، عن السيمبتومز بتاعته، عن السلوك بتاعه. all these results and observations are pushing us to embrace that this is the time to go pragmatic. We have to be realistic, practical as much as we can, more than any other time before. Because this situation will not be ideal to act theoretically in the correct way في أي وقت قريب anytime soon. والتاسك فورس كانت حاجة إن هي تاخد الابروتش ده، وكان في several web meetings امتدت لحوالي 32 hours ما بين التاسك فورس members to establish guidelines that are suitable to our national and similar international communities، لأي community آخر ممكن يكون مشابه لينا. كان في thorough literature review was done لأن احنا نلاقي المواقف المشابهة، أو إن احنا to search for other similar circumstances and situations، وإيه اللي اتعمل فيها كsolutions عشان نواجه الخطر بتاع الانفكشن. والحمد لله في اخر المشروع حصل publishing للدوكيمنت من fertility which was حاجه كويسه جدا ان هي حصلت في الاخر نجاح. واشكر كل اللي كانوا موجودين في التاسك فورس على مجهودهم وتعبهم، ودورت ريتشر بشكل دقيق جدا جدا، وكانوا سبب قوي ان احنا نقدر نطلع بالدوكيمنت ده. وان شاء الله نكون كتاسك فورس ساعدنا الكوميونتي ان هو يبقى عنده جايد لاين واضح يقدر ياخد منه اللي يقدر ينفذه عشان يساعد في حمايه التيم بتاعه. والحاجه دي اللي بنأكد عليها انه these guidelines prioritized the safety of healthcare providers, patients, offsprings and the future generations. تمام، شكرا ليكم و stay safe. انت محمد زياد معاك المايك.
شكرا دكتور احمد على المحاضره. استاذن الناس بس لو في حد عنده اي سؤال ممكن بس نكتب السؤال على الشات عشان نجمع كل الاسئله في النهايه ان شاء الله نجاوبها باذن الله.